tests. And that compares to last week, it represents a 15% decrease. At a period where we should be testing more, unfortunately, a continent is not doing a lot of much testing, which again, I suppose here to make an appeal to all member states to increase the testing. We at Africa CDC continue to supply countries with a lot of antigen tests and PCR, that is a molecular test. So please, we should use those tests as much as possible. The only way to find infections and control them is to conduct more testing. In terms of vaccine, in terms of important events coming up, first of all, we have two important events coming up, and we will come back to this in due course. First of all, there's going to be an update on the 6th and 7th of December in Kigali, where we will be reporting the progress that we have collectively made in advancing the continent on the vaccine manufacturing front. If you recall, on April 12 and 13 of this month, we hosted a summit, a vaccine summit in Addis Ababa, where several heads of state spoke at that meeting. And at the end of that meeting, President Tshisekedi, as the chair of the African Union, launched the Partnership for African Vaccine Manufacturing, in abbreviation PAM. So the purpose of the meeting we'll be hosting in Kigali will be to provide an update on that. So stay tuned on that front. The second meeting that we will be hosting in December, that is, to be very specific, December 14 to the 16th, is the first international conference on public health in Africa, the first ever international conference on public health in Africa. I'm very pleased to say that already over 8,000 participants have registered, and several heads of states will be speaking, including our own chair of the African Union Commission, His Excellency Musa Faki Mohammed. You've probably seen some of the speakers on Twitter. So I invite you all to plan to attend that very historic meeting. It's the first of its kind. It will provide a platform for the continent to review what we have gone through over the last 2 years on the continent, fighting COVID and the impact it has on other infectious diseases, and begin to provide an opportunity to reflect on where we go to, or how we reimagine public health as a health issue, but also as an economic issue and a security issue going forward. So let me then conclude the remarks with an update on the vaccine and vaccination. As of 24th of November, the continent has received a total of 403 million doses of COVID vaccines in 54 member states. Again, I repeat, 403 million doses of vaccines. Of that, 221 million doses of vaccines have been administered, which corresponds to 55% of total supply. So what you are seeing now is that a lot more vaccines are coming in now, and the uptake is challenged because of the logistics and of delivery. The coverage, that is the total number of people that have been fully vaccinated today, stands at 6.6%, 6.6%. Some countries in Africa are making good progress. Morocco has vaccinated about 61% of its population fully. Egypt, about 12% of its population fully. Algeria, about 11% of the population fully. And Tunisia, 33% of its population has been fully vaccinated. In terms of the AVAC, the African Vaccine Acquisition Task Team deliveries, from the 17th to the 24th of November, 7.2 million doses of Johnson & Johnson vaccines were distributed to 15 AU member states. So far, since we started the distribution, a total of 21.7 million doses of the AVAC vaccines have been distributed. That is mainly the Johnson & Johnson. If we include those doses that have gone to the Caribbean countries, it brings the number up to 22.4 million doses of vaccines that have been acquired through and distributed through the AVAC mechanism. You always have to keep in mind that this is a single dose vaccine, which means to bring it to the equivalence, and I use the word equivalence deliberately, you have to multiply that number by 2, which means that if it was either the Pfizer or the Moderna or AstraZeneca, it would be a total of at least 44 million doses equivalent of the other vaccines there. So very important. We're very encouraged with this progress that we are seeing. And just to end, and we'll have a separate briefing on this, but I just wanted to flag this up that the first delivery of the vaccines that were purchased by the MasterCard Foundation contribution will be arriving the continent shortly. Or arriving the continent, meaning the distribution will start of those doses of vaccines. So I think we are very encouraged. We did mention this to you that we had a partnership with the MasterCard Foundation. We had moved those deliveries to November, and these deliveries will go to member states free of charge. Thank you, Wayne, and over to you.
Thank you very much, John. And we continue to witness there the good work that Africa is doing in terms of fighting the COVID-19 pandemic. So now let's go straight to people who are online. And the first one is Sophie Mukwena from SABC. Good morning, Sophie. Sophie, good morning.
Yes, good morning. Dr. Nkenkesong, we see South Africa experiencing a rise in terms of the positive cases of COVID-19. And there are concerns that we may be heading towards the fourth wave. When you look at the past events during the campaigns, during elections, but also the reports that there is a new variant that is circulating in South Africa, and reports are that it is Botswana, Hong Kong, and South Africa. Are you aware as the CDC in terms of what's happening in South Africa on COVID-19 numbers? And then the reports about a new variant that is circulating.
We are fully aware of the situation in South Africa. And again, remember, South Africa has been reporting, has been very transparent in reporting its cases, regardless of how severe the pandemic is. I think we continue to see good trends in South Africa, but worrying trends that it might be tipping back up in South Africa. And that is even more worrying because we are moving towards the holiday season where there will be movement of people around. And if you recall last year, Sophie, around December, we predicted that in January, February, we'll see a sharp rise in the number of cases. And we saw that, okay, that is our, most of our, the numbers increased significantly, not just in South Africa, but across the board. So yes, we see that, we're seeing that trend in South Africa, and of course, we are observing that very closely. In terms of the new variant, it is, we will not comment on that now, other than saying that, to say that, yes, we are in contact with the authorities in South Africa. We plan to have a briefing with them early next week to understand more so that we know exactly what is this variant, what is the impact of the variant, because there are so many variants out there, but some of them have no consequences on the trajectory of the epidemic, excuse me, and some do have a significant impact, like the Delta variant and the Beta variant that was reported in South Africa. Excuse me. So please bear with us so that we have a chance to look at that data very carefully before we can make any public pronouncement.
All right, thank you. We have someone who's written into our question and answer section, and that is Mario Baptista, who is with Lusa News Agency of Portugal. And so Mario says, how do you explain that some countries in Africa are already administering the third shot of the vaccine? And he mentions Algeria, Tunisia, and Cape Verde. And he says this is happening while the continental average is only around 6%. So that's the question from Mario.
No, absolutely, Mario. Our position in this is very clear, and it should make what I call a common sense position. As a continent, we need to get to 70% of full immunization, which means people that have received 2 doses of vaccines. Today, as I just mentioned, we are at 6.6%. So from a policy and programmatic standpoint, our goal should be to lift the continent from 6% to 70%, not trying to do boosters, because we know and are aware that if you have 2 shots of vaccines, it offers a remarkable effectiveness in terms of protecting you towards severe disease and hospitalization. So that's an overall policy guidance. Now, individual states tend to do what they have to do. I mean, Africa is not a country. Africa is made out of 55 member states. Our advice for that to member states who have succeeded in scaling up vaccines and then interested in doing the boosters is that you target those who have immunocompromised conditions and the elderly. I mean, you start with that number, but you do not make boosters of the vaccines, especially the 3rd shot, a universal thing, because we truly don't have the vaccines on the continent. Let's prioritize getting from 6% to 70%, and then we pick it from there once we've immunized a good chunk of the population.
Thank you very much for that. Let's go back online and say hello to Gabrielle Steinhauser, and she's with the Wall Street Journal. Good morning, Gabrielle.
Good morning. Thank you so much. I have a question on these new COVID-19 antiviral pills, where the late-stage trial data has been very promising. And obviously, there have been some deals to make the manufacturing or license the manufacturing to generic manufacturers. Are you, despite these moves from the pharma industry, are you still concerned that there could be quite significant delays for African countries to access these pills, given that it will take time to scale up the manufacturing? And also, you mentioned that there's not enough testing happening in Africa, which is obviously a key precondition for taking these pills because they require this very early diagnosis. So I'm just trying to get an assessment from you of, what these pills could mean for the continent and how concerned you are that we might actually see a situation similar to the vaccines where African countries are being left behind. Thank you.
No, absolutely, Catherine. There's no doubt that first of all, let's celebrate the good news. The good news is that these drugs have been available. That's antiviral, one from Pfizer and then one from Merck. And especially the drug from Pfizer, which is showing us that with an efficacy of up to about 89%, that it will be remarkable. The good news also is that Pfizer is ready to let the manufacturing be produced elsewhere. There's the generic part of that. So we are in discussions with both companies. Just yesterday, we had an extensive discussion with Pfizer. We had Strive Masiwa and others to continue to negotiate on how we can get those drugs at affordable rates and as quickly as possible for the continent. So we had those conversations, and that is the 3rd conversation we're having with them. So we are very encouraged with what we are hearing. Today at 10 o'clock, 10 o'clock Eastern time, we will be discussing with the folks from Merck together to see what we can do in terms of moving that manufacturing as quickly as possible. We have other groups in Africa like Aspen also engaged in these discussions. So we are not just waiting for these things to play out. We are actively engaging to see what we can do so that we avoid the inequity and inequality situation that we have observed for diagnostics and vaccines. With that instrument, if we have that, the drugs, then we have 3 things that we have at our disposition. We have the public health measures that we can rely on, backed by testing. Then we have the vaccines, and then we have the drugs. So that gives you a very strong toolkit to fight the pandemic on the continent. I want to be very clear that vaccines alone will not get us over the finish line. We have to do vaccines, and we also have to do treatment and combine both of them, and together with public health measures. So your point is very relevant. We are working as hard as possible to make sure that the continent is not left behind with respect to these new developments and new pills.
All right, thank you. Judith Akolo joins us from the Kenya Broadcasting Corporation. And she says, my question to Dr. Nkengasong is, are you optimistic that Africa will indeed reach the 70% vaccine coverage, given that people in countries with low infection rates like Kenya are reluctant to go out and get vaccinated?
I think, Judith, the 70% rate and even more is a programmatic imperative target that we must achieve for a continent, for our continent to be protected. You are seeing what is happening in Europe and also in the United States, where large numbers of populations have been vaccinated, but there's still challenge. Just imagine if they were not vaccinated, hospitals would be full with people suffering from COVID. We should remember and always remember and not be deceived that because we are at the trough of the pandemic, which means that we've gone through the peak and then we are at the base, that the pandemic is over. The pandemic, of course, we have seen these waves come in. They come in and then they slow down for about 1 to 2 months and then pick up back. And when the wave come, they come severely. If you remember what I said a few weeks ago, 80 million, about 80 million Africans died during the third wave when the third wave surged. So again, this is an appeal to the population. Do not be complacent. This virus is dangerous, it's out there. You may not be seeing large numbers of infections and death during this transmission season, but you will have the next wave. Let there be no doubt, you will have the next wave. 11 countries in Africa are now experiencing the fourth wave, and you will have the fourth and the fifth wave. That's just the nature of pandemics. So again, my appeal to the continent is get out there and get the vaccines. And all of us should do everything possible to encourage our loved ones to go out there and get their vaccines.
All right, thank you, John. Liane de Bassompierre of Bloomberg says, can you specify which new variant you are looking at in South Africa? And is it the same variant as the one in Botswana?
As I said, I mean, just please be patient with us so that we do not rush into giving you information that is not complete. We promise you that by next Thursday, next Thursday, you get a full picture of this. This is emerging, and there's no value in giving you information that is not accurate. We want to come back to you and give you the exact information with respect to how many mutations are we seeing and at which point. Is it at the 614 spike protein, and what is the effect on the potential effect of vaccines and transmission? That's all the kind of information that we don't have at this point, and until we see the data, process it will be not appropriate to giving you information that is not accurate.
All right, thank you. Let's say hello now to Maggie Fick, and Maggie is with Reuters. Good morning, Maggie.
And we come out of that to take you to this.